Hey guys, Michaela.
Hi, I'm Ryan.
We're going to palpate the hip and the pelvis. Okay, so the first palpation would be the pubic symphysis, which is not typically palpated. You just want to make sure and keep note of it for referred pain. And then the first palpation will be the anterior superior iliac spine. You'll just want to place your hands on the patient's side, and then where your thumbs would normally fall is just the bony prominences or your ASIS. The anterior inferior iliac spine is located inferior and slightly medial to the ASIS. Not very easily palpable, but it's an important site for muscle attachments. The sartorius originates at the ASIS and runs diagonally along the side to intersect medially distal to the knee. The rectus femoris originates on the AIIS and runs along the anterior thigh and attaches to the distal knee. And then the iliac crest should be prominent on either side of the patient where your trunk begins to curve outward. You'll just want to palpate downward along the curvature until the bone is felt. The tensor fasciae lata originates on the ASIS. The muscle turns into the IT band and runs along the lateral thigh. The gluteus medius is the superior lateral buttock. The IT band, the iliotibial band, originates on the ASIS. The muscle turns into the IT band and runs along the lateral thigh. The greater trochanter, you would just start at the ischial tuberosity and move in a lateral inferior direction until you find the bony prominence. The trochanteric bursa is on top of the greater trochanter.
Okay, so we're going to do medial palpations now, and they're all one group. It's the adductor longus, the adductor magnus, and the adductor brevis. Okay, posterior palpations. You're going to start with median sacral crest. Is the fused sacral spinous processes starting below L5. The next is the posterior superior iliac spine, or PSIS. The posterior end of the iliac crest, often located just below the dimples of the back. The gluteus maximus. The majority of the superficial buttock also runs down the posterior lateral thigh, ending approximately halfway down the femur. The next, ischial tuberosity and bursa. Have the patient lying with leg bent or standing with knee up on the table. Palpate the middle line of the buttock. As you move inferiorly, you will feel a bony prominence. The sciatic nerve. From the ischial tuberosity, palpate laterally, approximately halfway between the greater trochanter and the sciatic nerve. The hamstring muscle group. Origin of the ischial tuberosity, running down the posterior thigh, inserting distal to the knee.